The technique that I use for vasectomy is the no scalpel vasectomy, which involves the use of some instruments that were developed by a Chinese fellow, actually, Lai, and this allows me to isolate the tube that we're interested in getting access to, making a small puncture wound through the scrotum and delivering that tube through the scrotal skin, operating on it externally and then allowing it to return to the scrotum, minimising the amount of trauma to the skin and minimising the trauma to any internal tissues. The great advantage of the Lai procedure, apart from its almost non-existent evidence of the procedure afterwards, is the reduced risk of bleeding. One of the most common complications of vasectomy is bleeding into the scrotum. Any bad stories you've ever heard about vasectomy really relate to that. Infection's really very uncommon, but occasionally bleeding occurs into the scrotum. The Lai technique goes a long way to eliminating that risk. We also like our patients to go home after the procedure and lie flat on that day. All they need to do is get a couple of movies sorted or a good book and plan to go home and lie down for that day. The next day, an easy day, go to the coffee shop, sit around, read the paper, do a little bit of office work, and then most activities you can resume thereafter. I could do a tradesman on a Friday and he could anticipate being back at work on Monday.